Welcome back. This is Africa 54. Well, Linord Moudou is off today, but in this report, she tells us about the newly released 2013 World Health Report. It shows how research can play a key role in improving countries' health systems. Here's Africa's 54's Linord Moudou.
The World Health Organization says countries should continue to invest in local research in order to improve universal health coverage based on each country's individual needs. This was stated in the World Health Report 2013 released last week. The report shows how countries, when developing a system for universal health coverage, can use research to determine what health issues should be addressed, how a system should be structured, and how to measure progress according to their specific health situation. The lead author of the report, Dr. Christopher Dye, is the director of the Office of Health Information, HIV/AIDS, tuberculosis, malaria, and neglected tropical diseases.
This report says that we have many solutions on the pathway to reaching universal health coverage, but we don't know everything by any means. And because we don't know everything, we have to do research to find the answers to many key questions.
Dr. Dye says biotechnology has an important role to play.
In terms of biotechnology, the world spends about $100 billion a year. A much, much smaller fraction of money is spent on designing health systems and health services so that they can effectively use that biotechnology. So we put an emphasis on translational and operational research because there's an enormous scope, we think, for rapidly improving the health of people by doing that.
The report reveals that, on average, domestic investment in research in low and middle income nations has been growing by 5% each year. Some case studies from many countries have demonstrated the importance of local and global research for improving health. They range from the prevention and control of specific diseases to the better functioning of health systems. The results of these studies emphasize the critical need for research to be carried out locally. Dr. John Reeder is Director of Special Program for Research and Training in Tropical Diseases.
So many times we hear the comment, well, why do we need research? Isn't it obvious? We just give a lot of bed nets out, it's bound to get better. We give a lot of drugs out, it's bound to get better. But really experience has taught us that isn't so. And a lot of things are counterintuitive, and that essential research at the right place in the right time can really make the difference between success and failure.
Reeder adds that the entire spectrum of activity needs to funnel down to the actual implementation of better quality healthcare in countries, in districts, and in clinics. The report says healthcare workers can also be made aware of research and evidence. They can also be trained to generate that evidence themselves, some of which will become universally applicable. Linord Moudou, VOA's Africa Health Network.
And that is our Africa Health Network report for today. For more health news and developments, please be sure to visit our website, africahealthnetwork.com.